Take a look at this electrocardiogram. We know that the following patient is healthy, but why is she crying? What is your opinion on it? To reinforce the question, why is this healthy patient crying? I recommend pausing the video to carefully analyze this ECG before continuing the discussion. Now, looking at the tracing, we can observe a sinus rhythm. The QRS complexes are quite narrow with an extremely short duration. The sinus rhythm is tachycardic. And if we examine the axis, we can see that it is deviated to the right. In addition to this, if we look at the T wave from V1 to V6, we can observe that the duration is extremely short, and in V1, it already starts with a large R wave, which usually doesn't happen. The normal QRS complex in healthy patients without any structural disease begins with a small R wave and a large S wave in V1. As we move from V1 to V6, the R wave grows and the S wave decreases. This is not the case here, which suggests a possible right ventricular overload. So we would have a sinus tachycardia with an extremely short QRS complex duration, a deviation of the axis to the right, and some signs of right ventricular overload. If this patient were an adult, we could probably consider some disease associated with the right ventricle. It could even be a pulmonary condition or a patient with congenital heart disease or pulmonary hypertension. However, in this case, this is a normal pediatric patient's ECG. So the changes I described for you, the axis changes, a large R wave in V1, the extremely short complex, and the tachycardic frequency are all normal ECG findings in a newborn patient. These electrocardiographic changes are normal in newborns and tend to regress with age. Thank you for taking the time to learn with us today. Please share this video with your colleagues, subscribe to our channel, and give us a positive evaluation. We hope to see you soon in our next video.